1 out of every 2 systemic lupus patients will unfortunately develop lupus nephritis. First, what is lupus nephritis? Nephritis comes from the Greek word for nephro, which means kidney. Itis means inflammation of. So lupus nephritis is inflammation of the kidneys that's due to lupus. I like the title of this talk today called Bringing Lupus Nephritis Out of the Shadows. Since it's really important that lupus patients know about lupus nephritis, and it's not talked about as much as we should. Number one, because it's so common, with up to 50% of our patients getting it. And if you know about lupus nephritis, there's actually things you can do to decrease your risk of getting it. If you know how we diagnose it and how important it is to diagnose it quickly and treat it quickly, your chances of doing well with lupus nephritis is greatly increased. So I'm so glad everybody's here today to watch this program so you can learn about lupus nephritis and we can take it out of the shadows. Today's program is brought to you by Aurinia Pharmaceuticals, and they're also the sponsor of an online community of lupus nephritis patients called All In. My name is Don Thomas, and I'm a rheumatologist in Greenbelt, Maryland. That's right in the suburbs of Washington, D.C. And for the past 25 years, I've specialized in treating patients who have lupus. One of my biggest passions and one of my biggest things that I feel strongly about is that lupus patients who learn as much as they can about lupus and who proactively take their own health care into their own hands, they by far do the best in the long run. So thank you so much for being here, because you're already showing that you're in that group of patients. And the knowledge that I'm going to give you today is just invaluable for lupus nephritis and how you can combat it if you happen to get it. So let's talk about lupus nephritis. First of all, what is it? Well, lupus, as most of you probably know, is a disease where your own immune system is overactive in attacking the body. And there's a lot of different autoimmune diseases. First, what is an autoimmune disease? The immune system is that part of our body that protects us. We get a strep throat, the white blood cells of the immune system attack the bacteria to keep us healthy and alive. But in people with autoimmune diseases, their immune system is overactive and attacks the body itself. So auto means self, immune refers to the immune system. It's an autoimmune disorder. Some autoimmune disorders just affect one part of the body. For example, the thyroid gland, one of the most common autoimmune diseases, the immune system just attacks the thyroid gland to keep it from working properly. But you know that anti-nuclear antibody that diagnosed your lupus? Just think about it. Anti-nuclear. Nuclear refers to the nucleus of the cells, the powerhouse of the cells that contains DNA. Every single cell of the body contains a nucleus. And so lupus has these anti-nuclear antibodies that can potentially attack any organ of the body. So it can attack the kidneys, the skin, the brain, the heart, the lungs. Unfortunately, it can attack almost any part of the body. And every lupus patient is different. If I put 100 of my lupus patients up against each other, they would all be 100% different from each other. And but when lupus attacks the kidneys, we call it lupus nephritis, and it's very common. Approximately 50% of our patients will develop it at some point in their lifetimes. So who's affected by lupus nephritis? First, let's talk about what it can possibly do. So as I said before, lupus nephritis is due to inflammation of the kidneys. And let's talk about what inflammation from lupus can do to any organ part of any organ system of the body. So let's use an example. Let's say that you pour some scalding hot water on your skin of your hand. That is inflammation at the max. Redness, swelling, heat, pain. Those are the 4 cardinal symptoms of inflammation. So you pour hot, cold water in it, you get medical attention, you get it healed up. But what's left afterwards? You're going to be left with a big scar on the skin, permanent damage to the skin. That part of the skin of your hand, not only does it look abnormal, but it's completely abnormal compared to the healthy skin tissue. It doesn't have any more hair follicles to make hair. It doesn't have the skin cells that make the proper skin pigmentation, so it's a different color of the skin. That's exactly what happens in lupus. Lupus first causes inflammation, and then if that inflammation is not treated, if it goes on without without stopping it, we end up getting permanent scar tissue. And that's what happens with lupus nephritis. You first get the inflammation part of the disease, and then if we don't treat it right away, you get permanent scar tissue and the kidneys stop working. The kidneys are so important for filtering out the blood and keep us alive and keep us healthy. But when there's permanent loss of kidney, that's gone forever. And if the kidneys go completely because of lupus nephritis, the person will need kidney transplantations and dialysis. And we want to stop that at all costs. So lupus nephritis is not as uncommon as you may think. Approximately 100,000 people in the United States have lupus nephritis. We know this because the Centers for Disease Control commissioned 3 very important registries during the past decade, looking at how many people in the United States have systemic lupus, and they estimated that around 200,000 people in the US have systemic lupus. So these are big numbers. Let's put them in context. What's 100,000 people? It's just hard to envision that, correct? Well, let's say that Lupus LA, they're a very generous organization, and I hope everybody joins them because they're very good at education, like bringing this to you today. But let's say that they decided they're going to do a wonderful thing and send everybody in the United States who has lupus nephritis on a cruise. Have any of you ever gone on a cruise before? I know many of you probably have. A cruise ship is like a city by itself. I've been on one cruise and it was just amazing. Well, the Lupus Foundation of Lupus LA, they would have to get the 17 largest cruise ships in the world. The 17 largest cruise ships in the world in order to hold all the people in the United States who has lupus nephritis. It's not rare at all. As far as how many people with systemic lupus get lupus nephritis, or when do they get it after their diagnosis, about 1 out of every 3 patients have it as soon as they're diagnosed with systemic lupus. But after that, it can happen at any point in the person's lifetime with systemic lupus. And we ask our patients to give us a urine sample regularly in order for us to help diagnose it. It occurs more often in women than it does in men, but if men get it, unfortunately, they tend to have a more severe disease course. Some ethnicities or races get lupus nephritis more often than others. For example, African Americans are 4 times more likely to get it than their Caucasian counterparts. Hispanics and Native Americans twice as more often. Right before this session, by the way, I went to the mailbox and I got one of my favorite journals, the Lupus Journal. It's my Bible for learning more about lupus. But one of the articles that just came in today, it actually comes from your neck of the woods, Southern California, and it's called the Southern California Lupus Registry. And it's all about the patients who are in the lupus registry in Southern California. Let me just share you the numbers about the people who have lupus nephritis, and it's on this graph right here. But of the white patients with systemic lupus, 16% of them had lupus nephritis. The Hispanics, 47%, a lot more than the 16% of the white patients. 53% of the systemic lupus Asian patients had lupus nephritis, and 43% of the Black patients. So there's definitely an ethnic variability as far as who gets lupus nephritis. So what are the symptoms and signs of lupus nephritis? And by the way, a symptom is something that you feel, what you tell your doctor is going on wrong with you. A sign is what we can measure and what we can see. So if we see something on the physical exam, that's a sign. If we see a laboratory test, that's a sign. So what's the most common symptom of lupus nephritis? Can anybody think about what that might be? The most common symptom of lupus nephritis is nothing. Most people with lupus nephritis feel absolutely no symptoms when it's occurring. If they have symptoms, it's usually because of something other than the kidneys, like maybe their arthritis might be flared up and they're having pain, or they might have an active butterfly rash, but no symptoms from the lupus nephritis. By the time someone is having symptoms from lupus nephritis, it's already becoming more severe. And this is so important because we want to get a urine sample from you religiously every 3 months to catch it at that period of time when you don't feel anything is wrong at all. That's why we want you to come in when you're feeling perfectly well. But what are these symptoms of lupus nephritis? Most of them have to do with the increased amount of protein in the urine. So the kidneys, they contain little filters called nephrons. And those nephrons only let the tiniest waste products go through them and into the urine. But when lupus attacks those nephrons and cause damage, the slits in the filters get larger, and protein, very important proteins from our blood, slip through those filters, and we can measure it in the urine. That's the very first abnormality that we see with lupus nephritis. But if someone gets enough damage to the kidneys that there's a lot of protein in the urine, that's when they get symptoms. These symptoms include swelling of the legs and the ankles. We call this edema. And the way this works is that the kidneys are very important for regulating proper water balance in our bodies. But when they're damaged from lupus nephritis, they're not very good at doing that, and the body holds onto too much fluid. You might have heard of people talking about fluid retention. So you get too much water inside your body, you're standing up and walking around in the daytime, and guess what? Gravity pulls that water and that fluid down into your legs. We have a very important protein in our blood called albumin, and albumin actually keeps the water inside of the blood vessels. But when you have lupus nephritis, you lose all of that, or you lose a lot of that albumin protein out into the urine. And so it can't hold it inside of the blood vessels. That water goes out into the soft tissues. Then it can go down into the ankles and feet while you're standing all day. Afternoon time comes and you see big indentations around your ankles where your socks are, or they might get so swollen. Some people, they get so swollen. If any of you don't know, Nick Cannon, who's a famous, he's on one of my favorite shows, America's Got Talent. He had severe lupus nephritis, and if you go on YouTube, you can see where his legs got the size of tree trunks. He had such severe edema. So that's one of the symptoms that can happen. Weight gain, the same reason, because of the fluid retention. Increased urination, especially at night. Again, it has to do with gravity. You have all that fluid down in your legs and feet in the daytime. You lay down at nighttime, the fluid redistributes throughout your body. The kidneys think there's a lot more fluid in there, even though it's just artificially so because you're laying down. And so it starts to excrete a lot of fluid and urine in the middle of the night, making you have to get up in the middle of the night to urinate. And then finally, foamy, bubbly, frothy urine, and that's because of the excessive amount of protein in the urine. There's other things that we look for in lupus nephritis patients. For example, there can be blood in the urine. We look at the blood work to see if there's any abnormalities of electrolytes like potassium and sodium. We can look at a blood test called the creatinine level. A high creatinine means bad kidney function. We also always want to check the blood pressure. The kidneys are instrumental in keeping normal blood pressure, but when you have kidney damage, there can be high blood pressure. The high blood pressure can cause more kidney damage. It can become a vicious cycle, so we absolutely have to treat it. And then unfortunately, if we don't identify lupus nephritis quickly enough, that permanent damage can happen with permanently decreased kidney function. So what are some of the complications of lupus nephritis? First is that high blood pressure that I mentioned, again, because the kidneys are so important for regulating blood pressure. And so we monitor the blood pressure very closely on our patients. And if it's high, we want to be aggressive at treating it because the high blood pressure causes more kidney damage. The kidney damage causes more high blood pressure. And it's that vicious cycle. And by the way, that's one reason why lupus nephritis patients have to take so many medicines. They might have to take 1, 2, or 3 blood pressure medicines to help protect their kidneys. Chronic kidney disease. Chronic kidney disease simply means that there's some permanent kidney damage. We can never go back in time and replace it. And that's why we want to catch lupus nephritis as quick as we can and treat it as quick as we can to get it into remission from keeping it from causing chronic kidney disease. There's 5 different stages of chronic kidney disease. 1 is the most mild. 5 means you need to go on dialysis. And we want to catch people, of course, before they get to either of those points. Cardiovascular complications. Cardio refers to the heart. Vascular refers to the blood vessels. Unfortunately, people with lupus nephritis have a much higher chance of cardiovascular complications, heart attacks, strokes. A stroke is basically a heart attack of the brain where part of the brain dies, and blood clots. Those are the 3 biggies when it comes to cardiovascular complications. The most common cause of death in lupus patients is heart attacks, strokes, and blood clots. They happen 20 years earlier than they should in our African-American women, 10 years on average in everybody else. It's so important you learn how to prevent those complications. And then finally, kidney failure. This is the end stage problem for lupus nephritis when it's not treated aggressively enough, or if we diagnose it too late and don't treat it in time. And that's what we're eventually trying to prevent, because once you go into kidney failure, then you have to go on dialysis, and almost all of our patients end up having to get a kidney transplantation. So what is the road to a diagnosis of lupus nephritis? Well, it mainly involves 2 primary specialists. There's me, the rheumatologist, and then my friend, the nephrologist. Nephrologists are kidney specialists. And there's 2 different routes that you can go as a lupus nephritis patient. I was very fortunate in that I was trained at a center where the rheumatologists were the experts with lupus nephritis. We learned how to take care of our own lupus nephritis patients. So when I get a lupus nephritis patient, I usually take care of that patient myself. I know exactly what needs to be done, and I am very obsessive with making sure that my patients get all the right stuff done. If it's a complicated patient, or if there's something else going on with the kidneys, then I'll ask my nephrology friend to get involved. But note, most rheumatologists, though, were trained in centers where they weren't the only caretakers of lupus nephritis patients. So the route that most people take is that if the rheumatologist diagnoses lupus nephritis in a patient, or if the nephrologist diagnoses a patient with lupus nephritis, they usually consult with the other one, and it's a team effort with the patient. And that's how it is with most patients. And by the way, if you have this team effort going on, if you see both a rheumatologist and a nephrologist, make sure they're sending notes to each other. They need to be communicating with each other on how to take the best care of you. I've seen too many mistakes where they don't send each other's notes to each other, and then that can cause complications in and of itself. So what are the tests to diagnose lupus nephritis? The most important one is that urine sample. This is why we have you come to us every 3 months and give us a urine sample. It is so important. If you develop lupus nephritis, I want to catch it immediately as soon as you start to get the problem. In treating lupus nephritis, we have a saying, time is kidney. What that means is that the quicker we can diagnose it, the faster we can treat it, catching that inflammation at that earliest stage before there's any permanent damage, that patient has the highest chances of going into remission. And that's what I always want for my patients. If there's just a 3-month delay in diagnosing your lupus nephritis, your chances of remission are decreased by 50%. 50%. And that's why it's so important to come to us regularly. It's a big pain in the butt, I know, especially when you're feeling good and you're doing everything you're supposed to on your medicines, but this is why I want to see you every 3 months. Blood tests are also very important. When the blood tests, we can see the electrolytes, and this is how we can tell what your kidney function is. The urine test tells us that there's active inflammation and damage going on. The blood test, that serum creatinine and something called the estimated GFR, those actually tell me how well your kidneys are filtering the kidneys. You can actually have horribly active lupus nephritis, by the way, with a lot of inflammation, yet have perfect kidney function. And that's when I want to catch your lupus nephritis, before you start to lose kidney function. And then the kidney biopsy is the most important test. A biopsy means when we as the physician, we get a tiny piece of tissue from your body and we look at it under the microscope to see exactly what's going on. With a kidney biopsy, usually an interventional radiologist or a nephrologist, the kidneys are in the lower part of your rib cage of your back and just underneath the rib cage. And what they do is they numb up the back with some anesthetic, stick a very tiny needle through there, grab a tiny piece of kidney, and then that's the biopsy, and they send it off to the laboratory. Please don't be afraid of getting this. You have to get the kidney biopsy. The reason for this is, number one, there's 6 different ways that lupus nephritis can occur, and I'll show that on the next slide. But also, it could be something completely different than lupus nephritis, and I won't know unless you get that biopsy. Just for example, hardening of the arteries can look just like lupus nephritis. Kidney damage and inflammation from diabetes and high blood pressure can look just like lupus nephritis. Infections can cause inflammation of the kidneys. And if I use immunosuppressants and steroids, I am not treating you correctly, because those can actually make your diabetes worse, or they can make an infection worse. So we have to have that biopsy in order to know what to do. If the biopsy comes back showing lupus nephritis, it can show us 6 different possibilities as shown on this slide. We call them classes. There's class 1 through class 6. If you get a biopsy, you're praying that you get class 1 or class 2, the 2 that you see on the left-hand side of the slide. You hope it's not class 6. Class 6 means permanent damage in almost the entire kidney. And unfortunately, that just means you will go on dialysis and you will need to get a kidney transplantation. The vast majority of our patients get the 3 in the middle, either class 3, class 4, or class 5. And I won't go into the details about the differences between them. That's more important for your nephrologist and your rheumatologist to hem and haw about. There are some subtle differences in how we treat them, but overall, we treat them fairly similarly with high doses of steroids and immunosuppressants, blood pressure medicines, etc., that we'll talk about later. So how do we treat lupus nephritis or manage lupus nephritis? First of all, it's an incredibly complex disease. There's no simple way about it. If you have lupus nephritis, you will be on a lot of medications, for example. We have to use the medications to calm down the inflammation. We usually have to use medications to decrease the protein in the urine. We have to use other medications to control the blood pressure, medicines to control the cholesterol, and then possibly even the sugar level. And most of our patients, we also want them on hydroxychloroquine. It's important that you work with your healthcare providers, and we'll talk about that on the next slide. Since it's such a complex problem, learning as much as you can about lupus nephritis makes a huge difference, because if I'm asking you to take 6 medicines, you're not going to want to take them. I mean, who wants to take 6 medicines a day? But they're vital. Those medicines can potentially get you into remission. And if you understand why they work and how they work, you're much more likely to take them. So learning about the disease and how it's treated is incredibly important. And you just being here and listening to this, that already tells me that you're one of those inquisitive people who wants to know everything you can. Diet and exercise are absolutely necessary. Remember, cardiovascular complications is the #1 cause of death in lupus nephritis patients, and it happens way too early in the lifespan of our patients. The secret to holding that off, by the way, is diet and exercise. There's been multiple studies that show that our patients who exercise regularly, they have much better cholesterol control, much better blood pressure control. They actually live longer, significantly longer than our patients who don't exercise. So learning how to exercise is just so important. It also increases the blood supply to those kidneys, which is essential. Diet is absolutely necessary, and we'll talk about that in a couple of other slides. And then healthy living, of course. So it takes a lot more than taking medicines, I hope you can understand and see. So there's a lot of different healthcare providers that are involved with treating lupus nephritis. There's me, the rheumatologist, my friend, the nephrologist, the kidney expert. I ask all of my patients to have a good primary care doctor. I can't do everything. I want someone who's going to be in charge of getting me a perfect blood pressure, perfect cholesterol on my patients, making sure they keep up with their screening, their cancer screenings and other primary care things. It can be devastating, of course, to deal with a chronic disease like lupus nephritis. Depression is incredibly common. And by the way, most lupus patients who have depression are undiagnosed and untreated. If you have the blues, if you're not sleeping at night, if you feel moody, if you stop doing the things you enjoy, please let your rheumatologist or primary care doctor know, because you may need to see a psychologist to help out, or antidepressants, etc. And then a dietitian or a nutritionist can be helpful with the diet part. So here's some tips on how you can be your own self-advocate. And this is right up my alley. I'm a huge fan and believer that patients who are their own best advocate do the best in the long run, and that's absolutely true. Of course, you want to keep track of your own medical appointments and your hospital visits. It's helpful to write down your symptoms as they occur. When you see the doctor, you're going to forget a lot of things you wanted to ask them. I know all of you can identify this. So anytime you have a symptom or a problem, make sure to write it down in your diary and then bring it in and show it to us when you come in for your appointment. One very important thing to do is to always keep records of your own health care at home. A big reason for this is that, let's say you change insurances or you move somewhere across the United States and it's been many years since your lupus was diagnosed. You go to a new rheumatologist, they do blood work on you. It looks like you're perfectly fine. They can't find any evidence of lupus, and they want to stop your medications because they don't believe you that you have lupus. I've had that happen in a few of my lupus patients, by the way, and they've had horrible flare-ups. But if you save your own medical records at home, you're protecting yourself, because if you're able to give those to other doctors, especially that kidney biopsy result, for example, you can save your life, basically. So, and the best way to do this, by the way, is every time you see your doctor, ask the front desk for a copy of the last doctor's note and a copy of the last labs, any x-rays that you've had, and by God, get a copy of that kidney biopsy, because that's incredibly important and you want to keep that forever. But if you build this up over time, you'll really be able to have a nice copy of your health records at home. Of course, you can always get all this at once when you leave your doctor, but that's going to be incredibly expensive for them to go through, because they will charge you to do that, because it's a lot of work to get everything over many years. So just get it piecemeal every time you see your doctor. Another very important thing, I'm so glad that Aurinia has this on the slide, is always keep an up-to-date list of your medications and drug intolerances and supplements and minerals and vitamins that you take. I'll tell you a little secret. Your doctor's list of medicines that they have in your office, it is almost always wrong. And there's a lot of reasons for that. Even when I see my own doctor, I don't go in and I won't say yes and no to the medical assistant as they're asking me about my medicines. No, I always take in an up-to-date medication list and I hand it over to them to make sure that it's 100% correct. Especially with today's healthcare, like electronic healthcare records, it's even more so. And I'll just give you a couple of examples. When I add a medication into the electronic health records, I have to be exact as far as the medication name, the dosage of milligrams, how many the patient takes at a time, and how often they take it, and the right pharmacy for it to go to. Any one of those that's incorrect and the medication is wrong. If I'm switching a medicine, not only do I have to add that medicine, but I have to physically go in and take out the old medicine. And it's very easy to forget to do that when you're in a rush taking care of patients. Another thing that can happen is that when a medication goes down to 0 refills, like for example, this happens in my electronic health records, the computer, a lot of times, it will automatically take that medicine away from the active list and put it into the inactive list. And all at once, you're supposed to be taking an important medicine, but it's not on the list. And so protect yourself by keeping that on the list, but also have your allergies, intolerances on it. Remember to have sulfa antibiotics as one of your allergies, as all lupus patients should. And then vitamins and supplements. Many herbal products are dangerous for lupus nephritis, so your doctor needs to know if you're on them. For some things like biotin, a lot of our patients will take biotin for their hair. That can actually cause your laboratory test to be abnormal. So we want to know if that's on your list. It's always helpful to have a family or a friend. Never hurts to have more than one set of ears. I always like it when my patients have their family members along with them. Of course, with COVID-19, we're usually asking you to only be by yourself in the room just for our own protection. But with virtually, you can do it. And then ask any questions you have. And what my recommendation is for questions is, number one, your doctor is human. He or she can only handle so much at a time. So I recommend writing down your 3 or 4 most important questions, make them short and sweet. And then as soon as your doctor comes into the room or starts the appointment, hand them over right away and say, doctor, I'd like to have these answered by the end of the appointment, because your questions are valuable. A big mistake that people will do is that they'll wait till the end of the appointment. The doctor's ready to go on to the next patient and say, oh, wait, I have 4 questions here for you to do. And then the doctors want to be rushed, and they're going to rush through those questions because they don't want to be too behind on their clinic. But if you do it right away at the start of the office visit, your doctor will make time for it. So this is COVID-19. This is April 2021. We've been dealing with COVID and seeing patients online now for over a year. There are some tips and tricks to seeing your doctor over the internet. It includes everything I just talked on the previous slide, by the way, so keep that in mind. But also, there's some other tricks. For example, have a reliable internet connection. If you notice, this program is going very well so far, and that's because I have my computer hardwired. I actually had someone in my family who's good with computers actually connected by a wire to the internet instead of by a Wi-Fi. That's the best thing to do, period. But if you can't do that, make sure you have very strong Wi-Fi. If you don't know how to do that yourself, get some help from a family member or friend who is very good with computers. A lot of the platforms that we use to see patients have something called a chat box, and utilize that chat box. Find out from your doctor if your platform has a chat box. I really love this on our platform. We use something called doxy.me, and what I like about it is I can type in things that might be difficult for my patients to understand when I talk to them. For example, let's say I use a medical term that I want them to look up on the internet. I can type it into the chat box so they know what to look up. Or if I know of a website I want them to go into, I can type it into the chat box. But do the same thing with your doctor proactively. Tell your doctor, could you type that word into the chat box? I didn't understand exactly what you said. Or also if they give you, let's say they tell you 5 things to do during your visit, ask them to summarize it and type it into the chat box for you. It can be very, very helpful. Wear the right clothing to your doctor's visit. I would much prefer if you wore a t-shirt and shorts and nothing else. You don't have to be dressed up to see your doctor, because let's say I want to do a physical exam and look at a part of your body. It makes it a lot easier if you do that. For example, I just had one of my lupus patients this morning. Very, very nice guy, but unfortunately he has really severe lupus where it attacks his nervous system and he can't move very well. But I needed to look at his feet. I actually wanted to look and see if he had edema. Remember the edema I was talking about earlier? And so he had to take off his pants and his shoes and his socks, and that took about 10 minutes. And so I would have liked it if he would have been dressed differently, but I don't want him to feel bad, so I didn't say anything otherwise, but it can be very helpful to dress comfortably. And then check your vital signs ahead of time. In fact, I would recommend that you do this for all doctor visits, even when we start to see people in the office again. Make sure you have a good blood pressure machine at home. Every lupus patient should have a blood pressure machine. We trust home blood pressure readings better and more than we do in our office. And so it's incredibly helpful for us as the physician if you bring in your last 3 blood pressure readings and show it to us, because if mine is high and yours are normal, I'm going to believe your blood pressure readings. Or it can be the opposite way around. For example, it could be normal here with me, but high at home. And again, I'm going to believe the ones that you got at home. So check your vital signs before all visits: blood pressure, temperature, and heart rate. So lupus nephritis, Treating it is a lot more than just taking the medications. Of course, the medicines are absolutely necessary, and you need to be 100% adherent with taking those medicines, but it's a lot more than just that. Diet plays a huge role. Remember, the kidneys are important filters, and so making sure that you get the proper amount of fluid inside of you, the proper amount of salt and proteins, and it's best to talk to your nephrologist or kidney specialist, or get some help from a dietitian to figure out what your best kidney diet is going to be. Avoid processed foods. Try to eat healthy and food that you actually make yourself at home from fresh ingredients. Processed foods, they contain a lot of salt. Salt will cause more fluid retention and high blood pressure. They contain fats called hydrogenated fats. What hydrogenated fats are, by the way, is that they take liquid fat like safflower oil, or olive oil, which are healthier oils, and then they add hydrogen molecules to it to make it solid, because they want to be able to have those cookies and cakes and those brownies nice and solid sitting on the shelf and have them last forever. But those fats that they have in them are much more unhealthy. Those are the ones that really can clog up your arteries. And then also there's high fructose corn syrup. The next time you get your favorite food from the store, look at the ingredients. Much of the time, high fructose corn syrup or fructose is going to be one of the top ingredients. Stay away from those foods because they're truly unhealthy. For example, fructose is converted into uric acid in the body, and that can increase your risk of gout, which happens in a lot of our lupus nephritis patients. Exercise is an absolute necessity, and everyone can exercise, by the way, no matter how sick you are. But everyone's definition of exercise is different. If you don't think you can exercise, just ask your physician for a referral to a physical therapist. And the physical therapist, they can evaluate your actual health and design a safe and effective exercise regimen for you. But it's essential to make those blood vessels healthier and to help your kidneys, your brain, and your heart, and prevent those cardiovascular problems. Low impact aerobic exercise is especially helpful and important. And be your own your own best advocate. And that goes without saying. Just simply with you being here, I know that you want to learn as much as you can about lupus nephritis, and make sure that you become involved with Lupus LA, because Lupus LA is just so good at educating their members about lupus and problems like lupus nephritis. And plus they help with advocating for research, because we need to keep working on research until we can find a cure. Wouldn't it be wonderful if we don't have to talk about lupus nephritis anymore? We just diagnose someone with lupus and then cure it. That would just be amazing. But we need to get research money to do that. So be an advocate for yourself health-wise, but also work with lupus advocacy organizations such as Lupus LA. So be engaged every step of the way. Make sure, because it's important, because 50% of systemic lupus patients will unfortunately develop lupus nephritis. And if you end up being one of them, you want to know the best things to do. Please give that urine sample every 3 months religiously, even if you feel perfectly normal, because we want to catch it early and treat it as quick as we can, because your chances of going into remission is much higher. Discuss your options with your doctor, by the way. There's not just one way to treat lupus nephritis. We have a lot of different medications, and different patients would prefer to use one over the other. So, and by the way, I never dictate to my patient which medicine to go on. I usually give them options, and I tell them the risk and the benefits of each of them. And then I tell them what I would do if I was you as the patient, or what I would have my mom do if I was the patient. But it should always be up to you. So always ask your doctor for options and continue learning. Absolutely, patients who learn the most about their disease do best in the long run. And you're already showing that you're doing that by just simply watching this presentation. If you're sitting there and you have lupus nephritis, consider joining the All-In community. This is a lupus nephritis online community where they're very good at educating their members about lupus nephritis. It is sponsored by Aurinia Pharmaceuticals, so thank you very much, Aurinia. You can find this All In community through Facebook, by the way. If you just type in, if you search All In Lupus Nephritis, you'll easily find it there. But they also have a website, allinforlupusnephritis.com. And just click the register button on the homepage in order to register. So in ending, just remember that 50% of lupus patients, unfortunately, will develop lupus nephritis. But there are things that you can proactively do for yourself to increase your chances of going into remission, and that's our whole goal. The quicker we can diagnose it in the inflammatory stage before there's permanent damage, the better chances you have of going into remission. And remember, it's a lot more than just taking medicines. It's diet, it's exercise, it's learning as much as you can about lupus nephritis. But just simply you being here today, you're understanding that knowledge is power. And learning as much as you can about lupus nephritis will help you learn how to combat lupus and not let lupus nephritis combat you. So thank you very much for having me today. And next, I will answer questions, and people have been placing questions into the chat box and to Lupus LA, and I'll bring those up right now. So here are some questions. First of all, number one, let's see, what are the most common lupus nephritis treatments? Okay, so this is a complicated answer because it's different for everybody is the bottom line. And what are the most common treatments? Well, it depends a lot on several different things. Number one, what the biopsy shows. Remember I showed you class 1 through class 5, they have different treatments. What the blood work shows, what your kidney function is on the blood work, what the urine sample shows. Do you have just a little bit of protein in the urine or a whole lot? What is your blood pressure? Someone with very high blood pressure, I would treat that person differently than someone with completely normal blood pressure. And then even your race. There's ethnic differences between how people respond to the different medicines. Just for example, Hispanics and our Black patients, they respond much better overall to mycophenolate compared to cyclophosphamide. And so if I get a patient who's Black or Hispanic, I'll usually choose mycophenolate over cyclophosphamide, and that's just one example. But there's also been recent guidelines that help us know what to do. In 2019, EULAR, which is the European Union League Against Rheumatism, they published some really nice guidelines that doctors can follow. And what they recommended, and what I completely agree with, is that people with severe lupus nephritis should receive high doses of steroids plus another immunosuppressant, a medicine that calms down the immune system to keep it from attacking the kidneys. This includes medicines like cyclophosphamide. It's the strongest medicine, but not in everybody. It doesn't work in everybody. Like I just said, in an African American, mycophenolate may be the better medicine. Mycophenolate is another one, also called Cellcept. Azathioprine or Imuran, it might be better in someone who's of Northern European ancestry, for example. Rituxan, which is the brand name for rituximab, that can be used. And then there's a group of medicines called calcineurin inhibitors. They can be incredibly helpful as well. Most rheumatologists will also have our patients on hydroxychloroquine. Absolutely important you take your hydroxychloroquine religiously. There was a study at Johns Hopkins that showed that patients with lupus membranous nephritis class 5, if they took hydroxychloroquine religiously, they were 3 times more likely to go into remission. 3 times more likely. So if you're missing doses of hydroxychloroquine, you're doing the wrong thing. Please take it as the safest medicine we have. And then in the last 4 months, the FDA has approved 2 new medicines to treat lupus nephritis, which is amazing. There's a medicine called Lupkynis, and there's a medicine called Benlysta. So now we have many more medicines in our toolbox than we've ever had before. So the next question, should hydroxychloroquine, which is Plaquenil, be reduced for lupus patients with chronic kidney disease? And this is a great question. This shows that someone who really has probably read a lot. So it is true that people, one of the big potential complications of hydroxychloroquine is damage to the back of the eye. And please don't be afraid of that, because the vast majority of our patients never get it. But it is increased in people with chronic kidney disease, primarily in those who have chronic kidney disease stage 3, 4, and 5, but much worse in stages 4 and 5. So in chronic kidney disease stage 3, we usually don't have to decrease the dose, because usually it doesn't make a big difference. But usually class 4 and 5, we oftentimes do need to decrease the dose. But what has really been instrumental in a game changer today is that we can actually measure hydroxychloroquine drug levels. Not all rheumatologists are doing it yet, because it is a fairly new blood test. But I measure this regularly on my patients, and I can tell exactly what dose my patient with chronic kidney disease needs based upon the drug level. So that's my biggest recommendation, is for rheumatologists to test that. Another question, by the way, is should hydroxychloroquine drug levels be done in all patients with lupus? So that's kind of a second part to this question. The answer is absolutely yes. Just last year, I wrote an editorial in one of our big rheumatology journals, along with Dr. Michelle Petrie at Johns Hopkins and Dr. Natalie Costadeau-Chalameau, who's a hydroxychloroquine lupus expert in Paris. And we said that hydroxychloroquine drug levels need to be tested in all systemic lupus patients who are on hydroxychloroquine. Number one, it helps us figure out if someone's being non-adherent or non-compliant with their medicine. But number two, it can help us make sure they're on the right dose. We know that, I mentioned that it can sometimes damage the back of the eyes, but that's more common if the drug level's too high. So if your drug level is too high and I see it on the blood test, I know to drop your dosage down. So it makes it much safer in my patients. So next, what is your recommendation for the frequency of retina eye exams in, the frequency of retinal exams in chronic kidney disease patients is actually the same in all patients. You should get 2 or 3 eye tests every single year. The American Academy of Ophthalmology in 2016 published really important guidelines. We know that if we do these newer eye tests, the eye doctor will pick up any eye problems before you would ever notice a problem. And these are incredibly rare before 5 years, and they're even rare before the 10-year mark of taking these medications. But they recommend getting a baseline test, and then starting at the 5th year of treatment, start to get yearly tests. Or if you're at increased risk of retina problems, like if you do have chronic kidney disease, you should start yearly tests right away. But you need 2 tests. You need a visual field 10-2 and an SD-OCT test. So visual field 10-2 and SD-OCT. And you need to make sure you have an eye doctor who has the machinery. These are very expensive machines. And I have seen too many patients come to me who are getting their quote unquote eye test done, but they were getting the wrong test. So make sure your eye doctor has the right test. If you're Asian, this is a very important thing. Asian patients, 50% of you will, if you get an eye problem from hydroxychloroquine, it occurs in a different part of the eye than in Caucasians and African American and Hispanic patients, 50% of the time. So you need a 3rd test called a visual field 24-2 test. So that's important to remember. 3 tests a year if you're Asian. So next, let's see here. It is common to find lupus nephritis in a kidney biopsy with very little abnormalities in the blood work and urine. Oh, no, that's a question. Is it common? Then the person says, my urine has shown consistently low levels of blood, but I had very little abnormalities otherwise. And so what this person is saying is that we look for a lot of protein in the urine, but she must not have, or he may not have had very much protein in the urine, but they had red blood cells in the urine. And then she or he says, my nephrologist, kidney specialist, suggested that I get a biopsy, which did show lupus nephritis. So she wants to know how common this is, and is there any way to know how my kidneys are doing without getting frequent kidney biopsies in the future? So number one, it isn't very common because usually we see excessive protein in the urine, but this absolutely can happen. Someone can have red blood cells in the urine and just a little bit of protein in the urine. And the only way to know what's going on is to get that kidney biopsy. So just like I mentioned earlier, you have to get the kidney biopsy for us to be able to figure that out. My guess from what you're telling me is that you probably did not have the most severe types of kidney nephritis. It probably is a milder form of class 3 or a milder form of class 5. If I had just had to take a guess, that's what my guess would be, but we're not always correct without the biopsy. But it needs to be treated, and then whether you get a kidney biopsy in the future or not, it all depends upon how you respond to treatment. We look at that urine sample and we'll be looking at those red blood cells and the amount of protein. If the red blood cells go away and your protein goes down to 0, you won't have to get a kidney biopsy except maybe 3 to 5 years after you've been on treatment, because I'm in the camp of doctors that I do think that repeating the kidney biopsy is important before we back off on our medications. That's the only way we can know if it's in 100% remission or not. But if you keep having the red blood cells in the urine and that protein in the urine, the only way to know if you're in remission or not is to repeat the kidney biopsy. I just saw a patient of mine last week. She had severe lupus nephritis, lots of red blood cells in the urine. She did have high protein. I treated her. The protein went away, but she still had red blood cells in the urine. I was afraid her lupus nephritis was still active. So I saw her 6 weeks ago, and I ordered a biopsy because that's the only way I could know for sure. Her biopsy came back showing she's in remission, even though she had some red blood cells in the urine. And the reason for that is that she had a little bit of damage in her kidneys, and that's why that was happening. But I wouldn't know she was in remission unless I would have got the kidney biopsy. So please don't be afraid of getting it if your doctor recommends getting it. So what are the chances of needing to go on dialysis or getting a kidney transplant if I'm at early stage 4 chronic kidney disease? And this is a 33-year-old patient. She says, I would like to also know how I can prevent further damage. What more can I do besides taking the medicines and having dietary restrictions? And I'm so glad you asked this question, because I have had patients exactly like you before who have had class 4 lupus nephritis and chronic, and stage 4 chronic kidney disease. And what that means is that this person has severely decreased kidney function on the blood test. And when someone has class 4 lupus chronic kidney disease, they're at increased risk of progressing to class 5, which is dialysis. I just saw a patient of mine yesterday who had severe lupus nephritis. I started seeing her 20 years ago. I got her into remission with treatment, but unfortunately, she did get into chronic kidney disease stage 4. That was 15 years ago. She's still in chronic kidney disease stage 4. She's someone who does everything I ask her to do. She exercises regularly, she eats properly, she never misses doses of her medicines. And I know that because I checked her hydroxychloroquine drug level. And so you can absolutely do it by doing all the right things. Take your medicines religiously. Also, be proactive with knowing what your numbers are. You want that blood pressure to be always perfect. For example, I like my patients to have the systolic upper number between 110 and then 120. So every time you get your blood pressure done, write it down. And if it's not perfect, you want to ask your doctor, what can I do to get my blood pressure perfect? Do I need to take another blood pressure medicine? Do I need to go up on the dose of mine? Because that can make a huge difference in the long run. Also, making sure your cholesterol is perfect. Same thing, if it's not perfect, ask your doctor, what can I do to get it perfect? Because I want to protect my kidneys. So those are some things that you can do to help out. And also avoid things that can damage your kidneys. Stay 100% away from herbal products, because there are herbal products that can make your kidneys get worse. And so that's really important. And then make sure you let your doctors know if you're taking these supplements. Avoid Advil and Aleve over the counter, because they can damage your kidneys as well. Another question, let's see. And this is my last question. So you're getting to the end, and thank you for following me up to this point. What is the likelihood of a lupus flare in a patient who already in a patient who already has lupus nephritis, and that patient is rigorous about compliance? My daughter's nephrologist response to my statement is that I want to do everything I can to ensure that she never has a flare. And the nephrologist said, oh, she'll have flares. The reason the nephrologist said that, my suspicion is that very few teenagers and children are 100% compliant. It's almost impossible. But if your daughter is 100% adherent and you do as recommended, and if she eats right, she exercises properly, there's a very good chance she won't have a severe flare. So I'm so glad you're being an advocate for your daughter. And I apologize, I went over time. Lupus LA, I apologize for that. I know you wanted me to be a little bit shorter, but this was such an important topic. And I just want everyone to know that you can be your own best advocate. The more you learn about lupus, the more you can take it into your own hands and keep lupus from hurting you yourself. And so I hope everybody has a nice weekend, and thank you so much, and goodbye.